you'll know from having grown up in Cyprus that the culture there, like in Greece where I grew up and in the Arab world where I'm from, that a doctor is a god. Whatever the doctor says goes.
Yeah.
And doctors are, people who you thank 100 times before you leave their office. You kiss the ground they walk on and you say, thank you so much for seeing me, for like taking the time, blah, blah, blah. And I feel like some people in the UK and in, the more Western world have this belief that, doctors, it's a vocation, it's not a job, it's something that they do because that is their destiny, and their entire job is to take care of other people. Their mental health isn't as important, their physical health isn't as important. Their job is for the patient, their job is to take care of the patient. Which I think is a really harmful position to put doctors in. And I think, the general public and people in other professions need to understand and respect that doctors, with the huge responsibility that they carry and with all the amazing things that they do, they are just normal people like you and me at the end of the day. And, they're not this superhuman who's immune to any mental health or physical health problems. and, they deserve the same rest, the same ups and downs and difficulties that someone in any other career deserves. They're not a superhuman god, as a lot of people might look up to them, and as I did when I was younger. So yeah, I think people need to cut doctors a little bit of slack. You can care immensely for your patients and you can do an incredible job, and at the same time have your work be your work. Those two things can coexist. It's not one or the other. And I think that's really important for people to understand.
I think social media and like the whole internet thing is making this it's kind of fading this away, this idea that you described. It's making doctors seem more human. Like, I don't know if Dr. Glockham Fleck, you probably watch him.
I love him.
Yeah, so he's an ophthalmologist. He does it, but then he just does comedy on the side. And then there's other doctors like on YouTube as well, like you, which you're normalizing it a bit and be like, look, I'm a person with other interests as well. I do other stuff as well, like I snowboard. And yeah, I think that's going to help in that kind of aspect.
I mean, I think that stigma is largely breaking down, but you still do get a lot of people, I think, especially in the older generations, who kind of have that feeling of your job is to just treat me and make sure I'm better. Like, how dare you not spend 100 hours with me and make sure that everything is okay and this and that. Like, look, it's okay. Some people come from older generations where that was normal and that's how they grew up and whatever. There's nothing I can do about that, and I don't necessarily blame them for feeling that way. But I think, as you mentioned, a lot of that thinking is changing, and it's not our responsibility, but part of what we do and the good that we put out there with the videos and the things that we do and make is a bit of breaking down that stigma of, doctors can still be respectful, polite, hardworking, dedicated to their patients, but normal people at the same time.
I hope these podcasts can help as well, because in a podcast you get to break down a bit someone's character, like how they react, etc.
Yeah.
And then I used to also ask people, like, I've stopped doing it now that often, but like, what movie do you like and stuff like that, and you're just like, oh, my doctor watches movies.
Isn't that strange though, that you think, oh, my doctor watches movies? Like, what did you think they were doing? Are they sleeping in the hospital? Like, they're sleeping with the patient, making sure they're okay.
You charge them at night and then they wake up the next day.
It's like, plug them into the wall and charge them.
Yeah, hopefully. Hopefully that doesn't happen sometime, because you always need you need the person's touch, a person's like, it's another thing, like, that's why I think the role of a doctor, or the role of a person in any job, not only in the medical field, the compassion that a person can convey. There's some studies on this, and like, we've got some stuff coming up, stay tuned. How important it is, like science-based. Like, if you touch a patient, that actually, when you talk to them in a compassionate way, of course, that kind of that increases the chances of their treatment going well, like significantly.
Yeah,
it's crazy.
I believe it entirely. Yeah.